childhood cancer is one of the biggest killers globally. And so there's a real fight on now to try and improve outcomes for children. We're lucky that we've had advancements in both genetic diagnostics and improvement in treatments. At Great Ormond Street, we are one of the biggest haematology, oncology, bone marrow transplant centres in Europe. We treat over 1,500 patients a year. So we've really benefited from a lot of these advances. We deliver state-of-the-art, cutting-edge therapies in bone marrow transplant, in immunotherapy, and in all treatments for children with cancer around the whole child. Yeah, so I think the UK just kind of set the tone back into 2012, when with the announcement of the 100,000 Genome Project, and from there we developed our genome medicine service to the point we're now offering these state-of-the-art technologies to every single child with cancer in the UK. And these initiatives are now going global. And as you'll see here in Abu Dhabi with the Emirati Genome Project, the same thing is happening. And these kind of initiatives where we're working together, absolutely amazing. And we're really seeing the benefits for patients. So now at Great Ormond Street, we offer comprehensive DNA and RNA panels. And then as of the last 2 years, we've developed whole genome sequencing. So every patient who comes through the doors has whole genome sequencing. And we're seeing the direct output of this in benefit for patients. This year, we've published an article in Nature Medicine where we looked at over 250 patients, and we've shown that we change management in up to 10% of patients. So these technologies really are cutting edge. They're really changing the boundaries, and they're really going to improve the outcome for children overall with cancer. So, I mean, we've definitely learned over the last 12 years in implementing this, and we hope we can have shared learning with Abu Dhabi on how you can really reap the benefits of it. And it's really starting to show now in our health service. So as I mentioned, you know, we changed management for patients. We're getting diagnoses where previously you couldn't get a diagnosis before. And overall, it's improving the care and the outcomes for children, which is our overall aim. Yeah, so funding is always a big challenge. But these big genome initiatives are excellent. I think shared learning is the other important thing. Education, shared research. And we definitely have a focus on that internationally at Great Ormond Street. We work very closely with our partners in Abu Dhabi and across the Middle East to try and, you know, shared experience, shared learning, all with the aim of improving the outcome of cancer for children. Yeah, so firstly, this is an amazing event, and I think these events are incredibly important. We live in a global world. As I said, at Great Ormond Street, we're an international centre for research. We have the Zayed Centre for Research, which is, again, a real cutting-edge, state-of-the-art clinic, which combines not only you have the researchers embedded in the same place as the patients and the clinicians. So this kind of partnership is absolutely amazing. And then to be able to come here to meet all different members of the health profession and for shared learning, it's an incredibly good event. And so I'm really, really pleased we're here. Yeah, I've been incredibly impressed. It's absolutely amazing that our motto at Great Ormond Street is the child first and always. And I think that's emanated across the whole of Abu Dhabi. So yeah, it's really exciting to see that message being spread across the world. Please, you should always start with the child. Child is first and always, and then everything else comes from there.